Hi everyone, my name is Amber. The acute disease that I chose was influenza. It's more commonly known as the flu, but it is not the same as the stomach flu. It's a viral infection that attacks your respiratory system, such as your nose, throat, and lungs. For most people, it will resolve on its own, but if it's not treated too long, it can become deadly. Children under 5, and especially children under the age of 2, or people older than 65. While the flu shot is not 100% effective, it's still the best defense against the flu. Some of the symptoms are fevers over 100.4 degrees, aching muscles, chills, sweats, headaches, dry coughing, fatigue, congestion, and a sore throat. The influenza is caused through the air in droplets from people coughing, sneezing, or talking. It can also be picked up off of like telephones or door handles, or from coughing in your hand or sneezing and not washing your hands or using hand sanitizer or anything like that. It's contagious for about 24 hours before the first symptoms shown, and then for the following 5 days after. Influenza is always evolving, so you may not get the strain that you've already had again, but if you do, the severity of it will be not as severe. It's dangerous for high-risk people and can turn into pneumonia, bronchitis, and heart problems. The chronic disease that I chose is diabetes mellitus. I'm sure I said that way wrong. And diabetes is how your body uses blood sugar. Glucose is a vital thing for your body because it is an important source of energy for the cells that make up your body's muscles and tissues. The cause of diabetes varies by type, but can lead to too much sugar in your blood. Chronic diabetes are two different types, type 1 and type 2. The potentially reversible type diabetes includes pre-diabetes and gestational diabetes. Gestational is for pregnant women. Pre-diabetes is for it's borderline diabetes, basically. Symptoms are for diabetes is always thirsty, frequent urination, extreme hunger, unexplained weight loss, ketones in your urine, fatigue, irritability, blurred vision, slowly healing sores, and frequent infections. The cause isn't known for type 1, but it's when your immune system fights off your insulin-producing cells cells in the pancreas, resulting in too little to no insulin, causing sugar buildup in your bloodstream. Type 2 cause is because of your cells becoming resistant to insulin, and your pancreas is unable to make enough insulin to overcome the resistance. And some of the complications kind of shocked me. Some of the complications is cardiovascular disease, neuropathy, kidney damage, eye damage, foot damage, skin conditions. The ones that kind of shocked me a little bit was hearing impairment and Alzheimer's. I never really realized that Alzheimer's would be something that could be caused by diabetes.